Hi teacher, I'm Jade and today present the topic what are the effects of coronavirus to human health? In this topic, I'll talk about what happened and how, all in introduction. After, in the body, I'll explain the collateral damages. I'll give my opinion in conclusion. And finally, 3 questions and answers. Introduction. To fully understand the issue, we must ask ourselves, what is the coronavirus? Coronaviruses are a family of viruses that cause illness and circulate between humans and animals, hence the COVID-19 virus arises. But what is the COVID-19? It's a SARS-CoV-2 which appeared in China last December and spread throughout the world and was declared a global pandemic. It's very common that the main infect are older adults and people with chronic diseases, although there are also cases of young people and children. Actually, what happens in your body when you contract the coronavirus? The virus is capable of causing damage to the lungs, apart from other organs such as the heart, liver, and kidneys, as well as to the blood or the immune system. How is it transmitted? The virus can spread through a small liquid particle called the respiratory droplets expelled by an infected person through the mouth or nose. Main symptoms: fever, tiredness, and cough are commonly present, in addition to the less common flu, breathing difficulties, muscle and joint pain, sore throat, and headache. Today, we face various collateral damages caused by the pandemic, such as economic. Speaking in the economic ambit, we are going through a crisis because the world economic will contract by 5.2% this year, mainly due to employment. That means that 3.6% of millions of people will be in extreme poverty this year. In the social ambit, all collateral factors have social consequences in common, as is the lack of stable income, causing increased insecurity as the population seeks other means to obtain them. Also, the social discontent that affects the trust towards the government. Apart from the increase in violence, the lack in education, social mobility, generating frustration, hopelessness, pessimism to people. I also want to mention the psychological impact because it's important how we have felt about all this. That is, 61.5% of people have been overwhelmed and stressed since it started. 56.8% have a lack of concentration. 54.7% report loss of sleep due to worries, and 46.5% feel unhappy and depressed. Conclusion. A sincere think that for there to be a positive change in society against COVID, there must first be awareness about what we are going through, greater social understanding, generosity among all, and above all empathy towards others, so that we don't come in action that cause the disease to increase, apart from carrying out the sanitary measures imposed. Finally, some questions and answers. How to face the coronavirus? Get vaccinated, wear a mask, wash your hands frequently, keep our distance, and avoid crowds. How will the rate of COVID contagion go down? Will show when more than half of the population is vaccinated and everyone continues to take appropriate measures. How is the country facing this situation? Giving support to those most in need, resuming work activities, and providing medical care.